Good morning, and thank you for attending the 5th webinar in our New Mexico Recovery Series. The series is hosted by the New Mexico Economic Development Department in collaboration with the regional recovery coordinators around the state to offer information and resources to help New Mexico businesses and communities. My name is Jennifer Myers, and I'm with the Economic Development Department. For everyone that's registered for this webinar, I'll be sending the slides, the recording, and I'll also be posting it on our YouTube channel so you can reference it later if needed. And if you want to use the question function to ask any questions, feel free to do that. And if we have time, we will address them at the end of the presentation. So I also wanted to let you know about next month's topic. We will be interviewing Taxation and Revenue Department. So save the date, it's going to be October 21st at 1 p.m. They're going to review a lot of different things that they're going on. There's various workshops, IRS workshops, business tax help. They're going to be talking about the restaurant reduction and then also review the new cannabis excise tax as well. So if you're interested in any of the topics, please plan to attend. I want to take a quick moment to mention the 7 recovery coordinators. Each region has a recovery coordinator available to assist and connect resources to businesses, local governments, and communities. As you can see, they're all listed on this slide, so wherever you're located, there is a recovery coordinator that can help you. Last year, the New Mexico Economic Development Department was awarded an EDA grant to assist with economic recovery, but also to increase capacity. With the funds, we were able to hire 4 newly created positions, and we like to call ourselves a recovery squad. I'm the statewide disaster recovery coordinator. Felicia DePaula is the program development specialist, and Alex Greenberg is our financial program specialist. John Winscott is our newest member, and he's our economic and energy diversification coordinator. We really like long names at the state. I'd like to take the opportunity to highlight a few of our state programs. The first program is our Collateral Assistance Program, or CAP. The department encourages banks to make loans to small businesses in underserved markets. The New Mexico Economic Development Department can pledge cash to cover a collateral shortfall of a loan in order to enable financing. This translates to cash support up to 50% of the principal with a maximum of $250,000 for under-collateralized loans. The uses are very widespread, so you can use it for startup costs, working capital, equipment, inventory. So if you want to learn more, just click on the link that's provided on the slide. The LADA recovery grants were created in the 2021 legislative session, $200 million in grant funding to New Mexico small businesses that are experiencing financial hardship due to the pandemic. These grants are specifically tied to job creation, and they must be used for reimbursement of rent, lease, or mortgage payments, and they're prioritized based on severity of economic decline experienced by the business. This program is administered by the New Mexico Finance Authority on behalf of the department. The change to the legislation also included restaurants and small retailers. So if you want to learn more information about eligibility, just click on the link provided on the slide. There is also another program that's administered by the New Mexico Finance Authority. It's the Small Business Recovery Loan Fund. So again, this is a loan and not a grant. The program was expanded in 2021 session to make available nearly $500 million for loans for businesses that are experiencing financial hardship. And I'm not going to go through each one of the eligibility on this slide, but again, it's a very attractive loan. The interest rate right now is 1.625% for 10 years. So if you want to learn more, click on the link provided, or you can also contact me with questions. I want to take a quick moment to highlight a few of our economic development events. Funded Q3 is going to be September 28th, and if you're interested in attending, please contact Alex Greenberg. The New Mexico Rural Efficient Business Program does a monthly interview series, and the next interview is RMS Foods, which will be October 6th at 11 a.m. And I will be hosting the Northwestern Business Finance Fair. It's going to be October 20th, starting at noon. And it's a good event for Northwestern businesses to get connected with local resources and funding opportunities. So if you want to stay current on all of our events that I just mentioned, I would highly encourage you to sign up for our weekly wrap-up. It's a great way to stay up to date on the different resources available or the events that we're planning. So with that, I'm going to go ahead and transition to the speakers, the topic, beWellnm. So I'll go ahead and let you guys take over.
Well, thank you, Jennifer, and good morning, New Mexico. I'm Paul Bettis. We're going to be speaking about the Small Business Health Options Program, or SHOP, through beWellnm, the New Mexico Insurance Exchange, and also known as the Marketplace. And before we start, we'll go ahead and go to the next slide, Jennifer. So let me introduce myself. My name is Paul Bettis. I'm with the Albuquerque Hispano Chamber of Commerce and primary contractor for beWellnm and an outreach manager. And so our job is to go out to the 33 counties and ensure that all New Mexicans know, small business, individuals and families, our Native Americans, even our qualifying immigrants, that there is access to healthcare in New Mexico. Special panel guests today, experts, are Veronica Arzate, and she's a project director from the Albuquerque Hispano Chamber of Commerce for beWellnm. And our expert, Ryan Jaramillo, and he's the president of Apex Insurance Agency. And Ryan's going to be on board to help us answer some of those tough questions. Thank you so much, both Veronica and Ryan, for being here. And a special thanks to Jennifer Myers with all that she's been doing for this state and the New Mexico Economic Development Department. And we can go to the next slide. Thank you. So our presentation today will focus on Small Business Options Program, also known as SHOP. Remember, right now in New Mexico, there's more options than ever for small businesses and individuals and families to have access to health care through a health plan, an insurance policy through beWellnm. Today we'll be discussing benefits of offering health insurance, our small business basics. Is it budget friendly? And yes, it is. We're going to answer those questions. Your employees now have more choice. Free assistance. I'm going to be talking about this throughout this slide presentation. Through beWellnm, the New Mexico Insurance Exchange, we are offering all our help is free of charge. Our brokers, our enrollment agents, our enrollment counselors, the education and outreach is completely free through the state. We'll also be discussing enrollment periods. And we can go to the next slide. Benefits of offering health insurance. That's where you can step in as an employer. For as little as $0, a small business owner can potentially offer a less expensive healthcare option for their employees. Studies have shown that right now and in the past, one thing that an employee looks for when they're looking for that new job, or the prospective employee, is they're looking for a health plan or a health insurance benefit through the company. So right now, we all know that it's been tough to hire people. It's been tough to keep people at work. This might be a vacuum to assist in gaining those employees and keeping them. The benefits, it shows your employees you care. It improves your employee retention, promotes a healthy work environment. Productivity is up, provides about 50% of additional tax credit to the employer if qualified, and it strengthens your bottom line, and little to no cost to the business. On board today, we have Ryan Jaramillo, and if we need to speak to a broker for more information after this PowerPoint presentation, we'll be open for questions. Through the beWellnm website, we can also go through brokers and different means to get you more information. Next slide. Small business basics. Are you qualified for small business health options? That's always the question. Paul, am I qualified? And these are my answers. Do you have 1 to 50 full-time equivalent employees, or FTEs? Can you offer coverage to your full-time employees? And that's an average of about 30 hours or more, and be able to enroll about 70% of your employees that you're going to offer the insurance to. So out of the 100% that you offer, are you able to bring in 70% of those employees? The other question is, do I have to be from New Mexico? Yes, the business or individual or family need to be in New Mexico. Small business needs to have an office or a work site here in New Mexico. And just a quick note, to qualify for SHOP, you have to have at least one FTE employee other than the owner, the owner's spouse, the owner's partner, or one of the owner's members of the family. It has to be a full-time employee. And we can go to the next slide. SHOP also guarantees a small business that the ability to offer employee health plans regardless of pre-existing medical conditions. Very recently, I'm going to be giving some examples, some illustrations throughout. There were individual and family, though we're talking about small business. We had an individual who came up to one of our outreach tables to let us know that he had been diagnosed with cancer, and his insurance, his health insurance company had dropped him, and he sought beWellnm for help. He was able to come on a health plan through the New Mexico Health Insurance Exchange without any problem with his pre-existing condition, and he was just there to thank us, which is great. In all plans, we're going to cover the 10 essential health benefits. We'll talk about that later. And offers choice of comprehensive health and dental plans provided, and those dental plans provided by private insurance companies to the employer to offer employees. Employers also select a base plan and give the employees the option to choose a plan from any metal level. So available, again, these are available to businesses with 1 to 50 employees and also nonprofit. Next slide. Continue with small business basics. Employers are not required to contribute to their employees' premium. That is a change. So again, employees are not required to contribute to their employees' premium. However, employers can contribute either a set dollar amount or a percentage of the employee's premium. One thing to look at is you can also, employees can choose when new employees will be eligible for benefits under SHOP. So I know that some companies, some small businesses even have a probationary period, have time set for when a person will be able to come on board if they're paying the tax credit. So the employer will have the choice of when that employee will be eligible for the health benefit. Next slide. Now let's talk about what's covered. The 10 essentials that we mentioned earlier. We're looking at ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment. As we know right now in our country, in our state, mental health and behavioral health treatment is a very big topic, and I'm very glad to see that we offer those services through our health plans. Also prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness services and chronic disease management, pediatric services including oral and vision care. Next slide. Also more choices for your employees. Through the plans, there's 4 metal levels: bronze, silver, gold, and platinum. An employee may select from any plan option that best meets their budget and what their family needs are. This is not, and I want to say this a couple of times, this is not a cookie cutter approach. Each individual family, each person, we all have a different outlook on health insurance. It might be by age, it might be by pre-existing conditions, it might be by family size. Also, within the shop, there's 24 different plan options to choose from. Employees can either choose to buy from the base plan or buy up or buy down. And I can show you that here momentarily in an illustration that we're going to give. Shop carries within the state. Our carriers are True Health New Mexico, Presbyterian Health Plan, the HMO, Presbyterian Insurance Company, the PPO. Again, this is not cookie cutter. Each individual family will have an opportunity to choose the option that best fits them. Next slide. Okay, here's an illustration of our metal plans. We see the bronze plan, we see the silver plan, we see the gold plan, and the platinum plan. For today, we're going to look at the bronze plan. So the way this is set up, it's very easy. The highest cost when you use the health services, that means you're going to pay a lower premium. I give a hypothetical. This is just an illustration of possibly a young person who has comes on board with a bronze plan, and they're not banking on getting ill or sick or hurt. They pay a very low premium up front. But when they do go to the doctor, their out of cost, their copays or their out of pocket is going to be higher. And you can see that there on the bronze plan. And then we'll look at the gold plan. A little bit different. This has a higher premium, but a lower cost when somebody goes to be seen by their doctor or a specialist. So those are the contrasts. As you look at the platinum plan, it's a higher premium and even a lower cost. There's just so many options right now within the plans for a family to pick and choose or an individual to pick and choose which is going to be the best for them on the marketplace. What I like to illustrate this to is when we talk about marketplace and the broker like Ryan sits down with you, he'll be able to pull up several plans or 5 or 6 plans. It's almost like going to Travelocity and you're booking a flight to Dallas. What's going to happen is it's going to start with the lowest fare, and it's going to give several different carriers that have the different fares that you can pick and choose from as it pertains to your situation. It's very effective. It's a very it's a great program. I'm loving it. I also want to tell you, if you have further questions, we have an outstanding webpage, beWellnm.com. Any questions after this, I encourage everybody to go to the beWellnm.com. It's got a walk you through process with videos, with lots of information at your fingertips. It's a great website. Next slide.
And Paul, if I am able to add on that information, especially for employees, this is so important why you can come to beWellnm and utilize the expert free assistance from people like Ryan Jaramillo or the certified agents and brokers that we have available through beWellnm. When you are selecting a health plan, you don't have a lot of knowledge and you don't know, normally the mentality will be like, okay, I want to be very smart with my money, so I'm going to select a health plan that charges a low premium and I'm going to be saving money that way. But then when you go and talk to one of the agents and brokers, they're able to ask you about, what are your family needs? Do you have young children? Are you on that older category where you need to be going and seeing the specialist doctors more often than just once a year? And if that is the case, maybe you have to pay a higher premium under the gold plan, but then at the end of the year, you're going to be saving money because your out-of-pocket costs will be lower. So those are a lot of pieces of information that sometimes as a regular consumer, we don't know and we are not aware of, but having that free assistance of somebody that has the knowledge and can guide us is key. So thank you.
Thank you, Veronica. So true, and Ryan will attest to that. And it's just, again, the programming, what OSI has done with the health plans, it's brilliant. It's been a big help to New Mexico, and now more than ever, with what goes on and different types of things that have come up in the economy, on the health scene. Now's the time. Now's the time to get a hold of one of our brokers or enrollment agents to get signed up or have your small business signed up. And let's go and just talk about a bit about tax credits. Tax credits. Small business and nonprofit tax credits can be worth up to 50% of your premium contributions, 35% tax exempt for tax exempt employees. Note, the maximum credit for nonprofit employer is 35%. I just want to make that clear. Also, employers with fewer than 25 full-time equivalent FTE employees, you're not required to cover part-time employees working fewer than 30 hours a week or dependents of the qualified tax credit. So we're going to pay average wages of an employee of less than $55,000 a year, and we need to be able to buy the insurance. What we're talking about here is through SHOP, through beWellnm, the New Mexico Health Insurance Exchange or the marketplace is where we need to purchase this. Also, the small business to contribute at least 50% towards the employee's premium. Very important. Those are things that that are prerequisites, and they work well for those that have used them. And we can go to the next slide. This is an illustration of the small business tax calculator. This is on the beWellnm website. We will be giving you more information at the end of the presentation on how to get there. Great tool. We've been able to use this. It's something that you can go in. There's also one for individuals and family. This is a tax credit. And it just asks the basic questions. Does your small business offer health insurance? Yes or no? Then you get to plug in how many full-time equivalent employees. On the right-hand side, you have the question marks if there's any questions on that. What is the total estimate of employee wages annually? Do you pay at least 50% of your employee's insurance premium? And then how much do you contribute toward employee health insurance premium annually? Once you answer these questions, you submit this, it'll take you to a new page, and it's going to give you an estimate of what the tax credit for your company is going to be. It's a wonderful tool, a very basic tool. Again, I can't say more about the beWellnm website and the tools that are there for people to figure it out. And I don't say this jokingly, but if I can use it and figure it out, it's very simple to use, especially when it comes to math. So it does the math for you. It's a wonderful product, wonderful product. Next slide. Okay, if you're not ready for the small business option plan, don't worry. We also work with individual and family coverage for our employers. Not everybody, not every nonprofit, not every small business is ready to dive into a small business plan. Coming back from COVID, the rebuild, big things is some small businesses don't think they can put another thing on their plate. However, small businesses, nonprofit, we do offer individual and family coverage for your employees. If you're a larger business and you have employees that are half-time, three-quarter time, that do not receive medical benefit or benefits through the company, we can help with that also. Individual family and coverage can also include an optometry option or a vision option. And that's something that you can talk to the broker about. Recently, I worked with an individual and a broker, and they chose the vision option, which added an extra $9 a month to their premium, but they had the vision care that they needed through that plan. Additional premium assistance is available through the American Rescue Plan. We're going to talk about that here in a minute. That went into effect April 1st. And what that is going to do is that's going to lower the cost of an individual's premium. Also, something that we learned a while back is that Bernalillo County alone has over 16,000 residents that could qualify for a $0 premium bronze plan right now. That's unheard of. That's if this is the time to be seeking health insurance, and there's no better time to do that. And we can go to the next slide. So here's an example of what the American Rescue Plan can do for us. It provides reduced health insurance premiums, and that began April 1st. If you look over to the left, you'll see the ages. Let's look at a person at the age 40, and then I'm going to give you some examples after this. Their annual income is $40,000. Now, your plan is going to be based on your income and your family size. So we're looking at this person, $40,000 a year. Under the old law, they would be paying for a bronze plan. This is the bronze plan, $219 a month for a premium. Through with the financial assistance of the American Rescue Plan, the ARP, right now they'd be paying $108. Let's look at the silver plan. Under the old law, $322 a month for a premium. Their new premium would be $211 under the new ARA. Also, the gold plan, $307 a month under the old law. Under the new law, $196 a month. So you see the substantial difference in savings through the premiums that are coming in to assist people. We can go to the next slide. And we can help. Certified brokers are there to help. I also wanted to just mention this. I recently had a person in our office as I was working with a broker over the phone. He was age 69 and he needed to find a plan. He had retired. He had no benefit leaving his company, age 59, and he was able to find a bronze plan for $369 a month. And then he was looking into a gold plan that was just under $600 a month, which are great prices, $369 a month. A lot of people don't pay that in a working plan. Also, very recently, we had a small business person who qualified for beWellnm, and they had a change in life. His wife had passed away. They were offered COBRA for him and his son. He was paying $1,000 a month for health insurance for him and his son. He came on board with beWellnm, and his premium went down to $500 a month. And those are just a couple of testimonies that we've been getting from folks. So getting the help through beWellnm, using our certified professionals and our brokers that are free, is a great payoff. It's a great payoff, and there's more reasons to do that because we want you to be informed about your health options, your tax credits, the administration of your health plan, to have a broker there to administer that for you when you have questions. Life-changing events, let's say you have an addition to your family or there's a disruption in your family or something comes up, you can always call your broker. Also, for new employee sign up, our brokers are there, our assistance is there for that. Benefit questions, claims and more. As a small business owner, I'm sure dealing with claims, or even as a large business owner, claims and human resources, those can be taxing, but through claims and more, we can use our brokers, we can use our all the assistance that we have through beWellnm, and again, they're all free of charge. Enrollment periods. We can offer shop coverage to employees any time of the year. If you wanted to start your employees now, now would be the time. Also, for individuals and family, I want to let everybody know that we had a very successful special open enrollment period that ended August 15th. Now, our open enrollment period, we're ramping up November 1st, 2021. I want to just reiterate that we will be in open enrollment, beWellnm, the New Mexico Health Insurance Exchange, November 1st, 2021. So very important dates. We want to get as many people up and around in November before the holiday season to be considering what their healthcare options are going to be. Also, once again, all our certified brokers, agents, and enrollment counselors are free of charge. We have also a business engagement team at your assistance. You can reach the business engagement team for further questions at 1-833-862-3935, and that'll be option 3 on your telephone. So again, business engagement team, the beWellnm business engagement team, 1-833-862-3935, option 3, or you can email business@beWellnm.com. Again, that's business@beWellnm.com. They can answer any of the questions that you should have. And we can go to the next slide. We're your resource. I want to say that again, beWellnm.com. Our webpage is phenomenal. Please go to our webpage and see our webpage, beWellnm.com. They've done a wonderful job putting that together. Keep in mind the dates and deadlines, November 1st for individuals and families. And just a quick note on that, for our Native American population throughout New Mexico, open enrollment or enrollment is any time. For qualifying immigrants in New Mexico, enrollment is any time also. So for our Native American population, we have great plans and great things for our Native American population here in New Mexico. Also for qualifying immigrants, they can enroll anytime. Small business, once you want to get your folks on board, they'll be enrolled anytime also. Again, our website is beWellnm.com, or you can, for small business, 833-862-3935. That's the general number, but option 3, you'll be transferred to our small business engagement team. Also, email us at business@beWellnm.com. If you have any more questions about that, we're about to turn it over to our panel. And I thank you. I thank New Mexico. It's been a pleasure. It's been an honor to be with you today. Again, I want to introduce Veronica Arzate. She's our Albuquerque Hispano Chamber of Commerce Program Director, and Ryan Jaramillo, who is the President of Apex Insurance, and we are here to answer questions.
Thank you so much. That was some really good information. Ryan, as you're drinking, I was just going to see if you wanted to have a couple minutes, since we're doing really well on time, to kind of talk about who you are and how you can help.
Sure. So, I've had introductions already. Thank you so much, Ryan Jaramillo. I'm the president of Apex Insurance Agency. So let me expand a little bit more on our role as a broker. So our job, and it's all free help, is to basically help the employer find a plan that's going to work for the employees and make it as easy as possible. And it goes across all levels. So not just for the employer, but for the employees, their dependents, their spouse, their children. And then we stay on as an advocate throughout the duration of the policy for any issues that they might encounter. Anything from ID cards to a billing issue, a prescription problem, and then you guys mentioned the claims resolution. That's really the big one that people really struggle with. I've personally fixed millions and millions of dollars of claims that were billed to people incorrectly that they've tried to fix, and it's not easy. it is very difficult to call an 800 number and get that stuff fixed. So that's the stuff that they can bring to us that we like to do. We want to help, and that's our role. We want to make things as easy as possible so that they have one place to go to for all their insurance issues and make it as easy as we can.
Thank you so much. We do have a couple of questions. One question is, can we cover 1099 contractors?
As a general rule, no. They want them to be W-2 employees. Yeah, so if you want to do an employer group plan, like through the shop, they have to be W-2 employees. And even if you went outside the shop, that's the general rule of insurance. They want them W-2, 1099 or contracted employees would not be eligible.
Okay.
Can I step in on that question also? So your 1099 employees, your official small business, the entrepreneur, they can contact us, beWellnm.com, and we can put them on an individual or family plan. That's how, and that's just, it's a wonderful thing. So that's the fail-safe when they don't come under an organization and they're their own entity. We can insure them through beWellnm.com under an individual or family plan.
Great. There is another question. I think this is referring to eligibility. Does it take into account if an employee or employees are covered by a spouse elsewhere, so they don't count towards the 70% of the employees?
Yeah, that's what they call a valid waiver. So if you have, just as an example, a group of 10 employees and they're trying to get that participation, any employee that says, I don't want the insurance because I have coverage elsewhere, Medicaid, Medicare, through a spouse, all those are valid waivers. They're not going to count that against the participation numbers. And that happens all the time. There's folks who have coverage elsewhere. They do not need it, and they just do a waiver form. No problem.
Okay. What questions do I ask my staff to get them interested in signing up for the company-sponsored health plan? Is there any type of marketing material that you can present?
Yeah, so you basically, you do an initial survey, and then the wording that I think is really important to use is we're investigating the possibility of doing a group health insurance plan, and you ask their interest level. There are some folks that are going to say, I don't want it. I've got a great deal through something, the VA, or I got something through some other entity. And there'll be other people that say, yeah, very interested. You take those interested people, you would give that information to me. We basically get some group quotes through BeWell, and then you can look at some numbers. And then we take the next steps to see, does it make sense to try to do a plan, or maybe we need to go through the individual market, taking advantage of those tax credits.
Good. That's good information. Can you say the URL one more time? There's some people having some issues getting onto it. Just the beWellnm URL again.
It's just beWellnm.com.
Okay. And then what if you can't get 70% of your employees to enroll?
If you can't meet the participation, which is extremely rare because again, we have those waivers, then it would be just going through the individual market and taking advantage of the tax credits available through the marketplace.
Okay.
So to answer that question, if you're a small business and you don't have the minimum amount of participation, the 70%, you can contact us. You'll have our contact information. We would be happy to go via Zoom or in person and do a presentation to your employees. And also we could schedule a broker to be with us and schedule that in a timely manner where we can offer the individual and family plans immediately while we're there.
And another thing that I would like to add, Jennifer, is that it's very important for people to hear, like you might be able to go and purchase health insurance through one of the carriers, or when you type health insurance on your Google search, there's lots of options that become available, but it's very important for people here in New Mexico to know that it's only coming through beWellnm that you will have access to those certified plans. As Paul was mentioning, we covered the 10 health essential benefits. Sometimes you might be not aware and you purchase a plan outside, and then later on when your employees go to utilize the services, or as an individual, as a family, you go to use the hospital, you realize you have all these extra additional charges because that health insurance plan was not compliant with the Affordable Care Act. So that's one of the benefits. And then another benefit is when you come through beWellnm, the health insurance exchange, you are also accessing all the subsidies, the tax credits, the financial assistance that is available. And that is not available if you're outside of the health insurance exchange. So that's one big difference, you know, and sometimes as consumers, we're not aware of that, right?
No, I was not aware of that too, so I'm glad that you mentioned that. Another question is, do you know how long the ARPA funds are available? So the rescue funds are available?
Right now, that is scheduled to be all the way through 2022. And we're still waiting to hear if there will be extensions.
Yeah, so 2022. Okay.
And Jennifer, if I could go back to the last question real quickly, I was recently at a summit and it was put on by nonprofits for nonprofits. And there were so many nonprofits out there that have volunteers, half-time and three-quarter-time workers, people who are serving our communities that have no health plan. And so if you're affiliated with nonprofits or you have nonprofits stakeholders or partners, please let them know about beWellnm. We are here for through the shop or through the individual and family plans to reach those nonprofits. So many of our nonprofits their staff who help so much don't have what we're giving in information and what they can have as an insurance plan.
Good. Another question about, it's going to be talking about the tax credit. It says, would this be in addition to being able to deduct the premium that the employer pays on the federal tax return? And if that's too narrow, we can come back to this question and so just let me know.
So I'll chime in. So in general, the answer is yes, but you definitely want to check with your tax professional CPA to see exactly how that would come out. So there's no surprises. So you want to get, not their blessing, but you want to be upfront with them, telling them what you're planning to do so they can tell you, all right, here's how much of a tax credit you're going to get. And you can still take this as a deduction, as a traditional business expense for paying for your employees' health insurance. So you don't lose one of them, but you want to visit with your CPA so that you can see just how that works.
Good. This is a good question. Is there somewhere we can compare cost to what we're currently carrying? So like a comparison of what you can provide and what they're currently doing?
So role of the broker, that's really a hard thing for people to do on their own, to say where are we at and what else is out there. So we typically will use a spreadsheet to show here's benefits, here's rates of where you're currently at, and here are some alternatives that you might want to consider. When you can see that on like a one piece of paper on a side-by-side basis, that's the easiest way traditionally to compare the benefits, the rates that are out there. So that's how we've done it. I've never been able to find a more simpler way because there's just too many variables, but that's how we do it with a spreadsheet.
Oh, great. So people are wanting your phone number, right?
Awesome, okay. So we're local, so we're here in the Uptown area. So our phone number, 505, and it's 884-3400, 884-3400. And we're again here in the Uptown area. Our address is 1120 Pennsylvania Street. And you can just Google us, Apex Insurance Agency. We'd love to hear from you. Again, as Paul mentioned, all free help.
Well, great. And that brought I was going to ask you if it would be all right when I send the email out, I can put your contact information of the panelists. So if there's specific questions, they can contact you directly.
Absolutely.
With Paul and Ron as well.
Yes, and I was going to say, Jennifer, and now with the technology, somebody like Ryan, even though he's based here in the Albuquerque metro area, he's able to serve businesses that are in northern New Mexico or southern New Mexico, different parts of the state. So feel free to reach out to him, and just as simple as this, we can set up a Zoom or something virtual. Or if phone conversations are easier, you know, that's also an option for him.
Great, so you're statewide. That's good to know. Can you cover the PTE through SHOP, or is it just at FTEs?
Well, So I think they're talking about full-time, part-time employees. Paul, did you want to chime in, or you want me to explain that?
You can cover part-time employees, and Ryan probably has a better explanation. I'm saying you can. That's an option for you as a business owner, small business owner. Predominantly, the full-time employees are what qualify for the plans, but there are options for part-time employees, and then I'll hand that over to Ryan.
Yeah, so the employer picks the hours eligible for them to enroll. So 30 is the most you can say. That's full-time. So you don't have to say you have to work 40. 30 it means they're going to be eligible, but you could reduce it if you wanted to capture some of those people who are working part-time, and you can go all the way down to 20. So somebody can be working 20, they're the same as somebody working 30, they're considered full-time for the purpose of health insurance and would be eligible to enroll.
I'm going through a lot of the questions are very specific, so I'm going to just, and I'll send those to you after. One question, do the individual and family plans cost more?
So it's a year-to-year change, okay? So historically, the group plans have been a little bit more. There's been years where they were less. This past year, the individual market has been lower. The new rates that are coming out for 2022, I think we're going to see a flip again where the individual plans might be a little bit more, and it'll be carrier specific because they're all over the board. So that's why we have to do a pretty thorough analysis to make sure that we put people in the best spot, whether we go through the beWell for employers, for small businesses, or if we just do the individual market, because it's all over the board.
And what's nice is when Ryan sits with someone, or one of our brokers or enrollment counselors sits with people, they actually get to see the different carriers and what they offer, what the price ranges are for those different carriers. Some people might opt into something a little more expensive because they want Presbyterian. Somebody might want True Health, and that might be a price difference, but they get to pick and choose of what carriers they want, which is great.
Yeah, and if I could just add to that, Paul. So Paul's point is phenomenal. What beWell allows you to do as a small business, you could have, two employees. One could have a bronze plan with True Health, and the other one can have a platinum PPO plan with Presbyterian. So you can't do that any other place. Traditionally, you have to be a very large employer to offer multiple insurance companies, but you can do that with beWell, and you can offer all of the plans that are offered under the umbrella there for the carrier. So it's phenomenal. The flexibility is just terrific, and we really need more small businesses to take advantage of that flexibility through beWell. A lot of them are going direct now, which is fine, but the flexibility to the employees to be able to say, you can have Press and you can have True Health, tax as your doctor for UNM or Press or what have you, is just terrific.
Yeah, no, that's a very good point. Once you find a doctor you like, you tend to grab onto them and keep them as long as you can. One question is how to handle staff turnover like in a restaurant. Have you worked with a lot of restaurants, and how do you handle that as far as medical insurance goes?
Well, so in that scenario, the best approach is to perhaps extend your waiting period for newly eligible employees. So this is not something where you want to put them on like from day to hire. That person may not work out for the whole day, so you don't want to deal with that. So you can push it to like 60 days is one of the more common things. So first of the month following 60 days, which means if they're not there after 2 months because they didn't work out, they never went on the insurance, you don't have to worry about plugging them in and then taking them off or paying for that person. And if they stick around because they're going to be a valuable employee, that's great. They go on the insurance, and then they can access the care they need.
Great. No, that's a good idea. One question came up is, what is a qualified immigrant?
For immigration status, we have through beWellnm, on our website, I can provide that information also. I don't have it right in front of me to go through the list because it's quite an extensive list of immigrants who are here in the country legally, and they qualify for different reasons. They have a different status in the United States that they can qualify. Also, beWellnm has teamed with Medicaid and the New Mexico Medical Insurance Pool, and we've been able to use the New Mexico Medical Insurance Pool for immigrants who, because of their condition, cannot return to their country of origin. This might be a critical illness or a critical injury. The insurance, the New Mexico Medical Insurance Pool has a low income bracket that they may qualify for, and it might be a little more expensive than beWellnm or the New Mexico Health Insurance Exchange. However, they will have peace of mind. And again, we've had immigrants that qualify because of their critical injury or critical illness and they can't return to their home of origin and they need that medical care. So please contact me at paul@ahcnm.org. That's again, paul@ahcnm.org, and I can get you the PDF information for immigrants in New Mexico.
Thank you. Another question, where can we see participating caregivers in our area?
So the provider directories, they're all electronic now, so they want you to go to the website. So for True Health, you go to the True Health website. For Presbyterian, you go to their website, and then they have a provider search function. So you put your zip code, you can put a radius, you can search specifically for the type of doc or just generality for all the providers in that area. Some of those work better than others, honestly, some of those sites. So if anybody needs help or they want to verify stuff, reach out to me directly. Happy to look that up for you.
Yeah, kind of still going through. There's a couple more questions, but again, very specific. One question, is Blue Cross included? Because that's the only one that serves in their area.
They are not participating for small businesses, but they are certainly available on the individual market with the tax credits and the reduction.
Okay. Let's see. I think those are the bulk of the questions. I'm glad we had enough time to go through them. Again, if I didn't get to your question, I will send it to the panelists and they can address it offline. Well, this has been wonderful. If there's any last minute comments, I really learned a lot and appreciate you guys' time. And if anybody on the webinar wants to, I'll send the contact information. So if you have any questions that come up after this, feel free to contact even me if you want to get a hold of them as well.
And Jennifer, if I may, one thing that I spoke with Jennifer about, and our services are bilingual also. We are open to presentations, education in Spanish. A bulk of our information comes in English and in Spanish. So if you have employees that you want us to reach out to, or either way, bilingual or English or Spanish, we are available to give those presentations to your small businesses, to individuals and families. And so we are available anytime. Again, we are trying to ensure that all 33 counties of our state have access to a health plan.
Yes, thank you for mentioning that. That's a big plus, absolutely. Well, with that, thank you so much for your time, and thank everybody on the webinar. I'll be sending this again, the recording, the slides, and contact information. So thank you.
Thank you so much for the opportunity.
Thank you, Jennifer. Thank you, Ryan. Thank you, everybody.
Thank you for having me, guys. Pleasure.